Hi, today I'm going to cover electronic health records. That is the digital version of the patient's folder. That's the digital record of the patient's health information. That's essentially what it is. So there are different types. There are so many different types. And actually, it is a software managed by software companies. There are so many of them, over 600 of them. And then they are designed according to the setting where they are going to be used. There is the one that is designed for outpatient care, acute settings, long-term acute care settings, or different kinds of settings in the healthcare world. Those softwares are designed to suit that setting. So there are many, like I said, there are so many different types of them. I'm just going to mention a few. Epic, which is the biggest, the most widely used, and I believe the most elaborate. Then Meditech, MedHost, Senna, WellSky. There are so many of them. Now, you know that there are different healthcare workers that use that. The doctors use it, the pharmacists use it, the nutritionists use it. They all they have places or pages on that software where they do their own work. So there is a lot to cover when it comes to e-health records. I'm just going to zero in on what nurses frequently use. Not all that nurses use, but the most frequent ones, just to touch on it. So the first one is the MA, that's the medical record, the record where the medications are listed. In our setting back home, we use paper charting. So on the paper, the patient's medication will be listed. Then you, the nurse, will sign against the time you gave each medication. So it is similar, but this time around is electronic. There is a list of the patient's medication. You give the medication, you scan it because it has a barcode. So you scan it and then you sign off that you have given that medication, the scheduled medications and the PRN medications. That's one. That's where you spend most of your time as a nurse. Then another common one is the task. The task, TAR, they call it TAR. So for that is the tasks you perform for the patient. If you maybe place a Foley catheter, you sign it off there. There will be a list for each shift. There will be a list of all the things you need to do for the patient. If you are supposed to catheterize the patient, if you are supposed to monitor the Foley that you put in, any care that you give to the patient, oral care, whatever it is you do that is not medication, is listed there. So as you are doing it, you are signing it off that you did it. So at the end of your shift, you would have signed off. It's just like a to-do list for nurses. So at the end of your shift, you would have signed off on all those things. Then assessments. That's another big one. So you have to assess your patient head to toe. And other assessments that you need to do for everything attached to your patient, you have to assess. The patient himself or herself, you have to assess. You also have to assess if you give medications or a treatment, you have to assess if it's helping or not. So all those things fall under assessment, and you also have to do it. And there are pages where you document all those assessments. Now, it seems like a lot to do, but it is for your own good because it's an opportunity for you to document, which is very important. Document everything that you do for your patient and everything you see on your patient. Now, these assessment pages, they have assessment tools that are specific assessment tools that may be like a scoring system that will help you to assess the patient, such as 4 risk, the patient's 4 risks, the patient risk for skin breakdown, the patient's level of sedation. So there are specific assessment tools built into the main assessment frame that you can use, that you put in data into it. What you see on the patient, you put it in, like filling out a form, you put it in, and then it will vomit a score for you that will guide you on treating the patient. So That's it for the assessment. Then there's the I's and O's. That's intake and output. There's a page where you put that in. Then there's a place where you put in nurse's notes, your notes as a nurse. Maybe if there's something that was not captured in any of those specific, the MA, the TAR, the assessment, the I's and O's, if you are not able to capture anything you did for the patient there, you can put it in form of notes. Or if you want to do a summary of what you have done for your patient, you can just write it, type it in there. So like I said, it is for the nurses good, or whoever it is that is documenting, because documentation is very, very important. So it may seem like a lot, but be patient with it. You will get used to it, and make sure you always put in everything you're supposed to put in. Now, another thing to point out is, though most of what you do on the software is clicking, but there are times you need to type, so you should brush up your typing skills. I'm going to stop here for today. Thanks for listening. Make sure to like, share, follow for more. And if you have any comment or question that will contribute, please put them in the comments. Thank you.